it should not be there. The menstruation should be regular and there is no PCOS after the postnatal care. Healthy, beauty, and the avoid of the postnatal depression. It should be the aim of our postnatal care. So here, let me conclude the session of this Garbhini Paricharya and also this post. Actually, these two are vast topic. That's why I think very fastly I covered some of the points. Then we can have the discussion regarding these topics. Thank you once again. Thank you all for these organizers of this program and also all the delegates who are attending this class. Thank you once again. Thank you all.
Thank you, thank you, ma'am. Thank you for such an energetic session. So once we have a patient with the cervical incompetence, so if she had an abortion due to that, so what can we do to prevent that in the next pregnancy?
Okay, here also, just after, if she's having any cervical incompetency, before getting the next pregnancy itself, if possible, the Shodhana therapy we have to employ it by using Phalasarpi for the Snehabana and as a piju like Shashtiga labor. Shashtiga should be cooked in Bala and Kshira Bhaga. That should be kept as a piju for some days. That is also helpful to strengthen the cervix and in most of the such cases we can manage the cervical incompetence or even baladaila is also better to do as a piju dharana.
Okay, ma'am. So we can go to the chat box. We have a question from Dr. Ujjwala Shilar. Ma'am, what can we use? What what we can use pedal edema not related to hypertension, only Gokshura Kashaya is sufficient.
Okay. Yes, doctor. Here, the pedal edema is not related to hypertension. Then we can consider this Gokshura Kashaya. And another option is the Deshamula Kashaya. Deshamula Kashaya mixed with the Dhanantara Gulika is taken as internally, as in the form of medicine. Or otherwise, this porridge can be cooked with this Deshamula Kashaya is also found to be helpful to reduce the edema, except that related to hypertension.
What we can give as calcium supplement in Garbhini? Allopathy calcium supplement causes constipation in Garbhini.
Yeah, okay. Here for the calcium supplement, we are giving some food items like Chirapaga. Balak Chirapaga is very good. Then ragi preparations for the internal intake. And then Shanga Basma is also very good while adding to the Chirapaga as a calcium supplement.
How to maintain weight of obese Garbhini?
Yeah, actually, it is very difficult because the weight gain during the pregnancy is also happening naturally. On the first trimester, it will be first 1 kilo, then second on the 5 kg and 5 kg. About 10 kgs of weight gain is normally occurring during the pregnancy. But by taking this food have to, the restriction from the food itself is needed to avoid this nava and our polished rice should be avoided by adding some fiber content food intake has to be more like that we can consider the management of the obese company.
Next, we have a question.
If there is not having gestational diabetes itself, we can add some drugs like Misha, Ambelegi, then Asana Jala for Panaga. If we are using the milk, then skimmed milk or without any this means fat content of the milk should be avoided. Such things are to be considered for this obese Garbhini.
We have next question from Jayalakshmi, Dr. Jayalakshmi Vijayaraj. How to treat pain in the symphysis pubic bone area during pregnancy?
Yeah, okay. Some patients may develop this pain on the symphysis pubis bone area during pregnancy. Here we managed by using Dhanantara Thaila Pichu. Not in the too hot, but in the warm Dhanantara Thaila can be applied as in the Pichu on symphysis pubis will help to relieve that pain. Some internal medicines like if there is any edematous, we have to just examine that patient, that Garbhini. If there is any edema, then some local applications like any leba, if needed, some Jadamayadi leba or Kartavat, etc. Some lebas are needed, then we have to add that leba at first. Then after the edema is completely, if there is any local inflammation, if it is cured, then the Anandara Thaila Piju should be given. That is the main thing of management here.
Another question is, doctor, like polylegium for LSCS patients, if it is advised, which day we can start the legium? That's what the
Yeah,
question is.
actually in LSCS, this Pulilekha is not mandatory to give to advice because in LSCS we found that during this procedure itself, most of the Garbhashya Shokana is occurring during that time. No needed to increase the means local blood after delivery of the LSCS. In normal delivery, we are giving from the just after 2-3 days of the delivery itself, we can give the Pulilekha. In LSAS, if the lochia is not proper, then we can add Pudilechia, no problem. Pudilechia in mixed with hot water or otherwise in the form of granules we can take directly or otherwise in hot water or in takra without having any adding some water and takra we can give it or Budodaga itself we can add as a anubana for this Pudilechia.
The next question is from Dr. Sabina. She's asking, what is the effect of Tengin Pukuladi Legium? Is it a calcium supplement?
Not actually, not is considering as the calcium supplement, but the this thing in Pukula is considered as the important one indication for the low back pain and to stabilize the pelvic bone and like that. It's found to be effective as a preparation for the postnatal care itself.
Next question is from Dr. Jyoti. She's asking, which herbs is used to like which herbs we can mix in the rice podi, like while making that
Yeah,
steam.
yeah.
The names in
I think
Sanskrit she's asking.
some Malayalam names are to be like this Murikka. Murik is the irrigator, and that botanical name is available, and the picture is there. Let me check the Sanskrit name, and that I will. Let me inquire, and I will tell. Then some tracks are like Lekupada. Then Mukkutti is having Samanga. It's okay. Some tracks are there. On the first few days, that is one drug I mentioned. On the second 3 days, that is the Samanga. Samanga is the Sanskrit name. Then next is the Eshangar. Eshangar is the Sanskrit name itself. Then another 3 days, which mentioned as the Laghupada. Okay. Then inflorescence of the coconut. So whatever the available drugs, we can select it. This Samanga, Lagubada, Eshanga. Eshanga itself Sanskrit name, I think. Okay.
Next, we have a case discussion from Dr. Ujjwala. A patient age 35 years, LSCS on December 26th. In Jan was COVID positive. Feb, March also she got Shita Purva Jwara with severe joint pain and nasal bleeding. This patient not followed Garbhini Paricharya. Now patient developed a one hard mass in right iliac fossa. Scan not showing any a pedicular mass. She is breastfeeding the baby. What medicines can we use for her mass and recurrent jwara?
I think now she is, I think the patient is aged 35 years, LSCS on December 26. So December 26, now she is having January, February, March, April. Okay, 4 months after delivery. Now we can manage the, as usual, we are managing these cases, we can take, not considering this as in the Sutika. Because if it is any jara or otherwise, if she's having any joint pain, simply Amritottara Kashaya and Shadarna tablet as we are using in the Amavada is maybe helpful here. If there is any appendicular mass, you have to palpate and examine that mass. If it is any inflammatory type, we can add some Jadamayadileba or Nagaradileba Churna as an external application. And some internal medicines, I hope that is Amritottara, Punarnavadi, some choices are there, I think. Then Shadanga Kashaya, etc. may help to reduce that pain and the swelling. Okay.
Dr. Ujjwala, you can just unmute and ask, add to this, doctor. You can unmute.
Hello, ma'am.
Yeah, okay.
Yeah.
Thank you so much, ma'am, for informative session.
Okay, okay. Thank
You
you.
have really explained all the topics very well.
Yeah.
Ma'am, this patient don't have any symptoms for that appendicular means scan also it is not showing, and doctor also got confused, means they have not done any perfect diagnosis for that. Only she's feeling, and there is no pain, no inflammation, nothing. Just like she felt that the hardness is there. So what? That's why I'm asking what we can do. Only Lepa, you have told what Nagaradi. Which one
Yeah.
you told?
Yeah. Okay. Nagharadi leba or Jadamayadi leba. Are you familiar with this Kartavattu or Krishnadi Guliga?
No, ma'am. No.
Kartavattu. No. Or Marmavat Guliga? No, I think.
No.
Oh, okay, if not possible, you may go for Nagaradi Lepachurna or Jadamayadi Lepachurna in Dhanya Amla. It may be helpful. Okay.
Okay.
Then another thing you explained about that patient, she is having this joint pain, severe joint pain, nasal bleeding, jara, etc. was there. Okay. So
Yes, ma'am. Yes.
yeah. So
She
this
got 3 times every month. She got a fever, and
oh,
she didn't. I have asked. She didn't follow the this Garbhini means
okay,
Sutika
whatever.
Pancharya.
Yeah, it's okay. Whatever it may be, you have to manage this condition by using Shadanga. Shadangapana, is it available?
Yes.
Shadanga, Amritotara Kashaya,
Yes, ma'am.
Sudarshana Vadi, Sudarshana, Shaddarana, etc. are choices, not needed to completely follow, but you have to take 1 or 3 medicines of that. I think
Yes, ma'am.
that,
Because she had nasal bleeding also once.
yeah.
So I have confused in this
No,
Shadanga. What
no,
it
no,
is?
don't worry about using this Shadagabana. Nothing to worry about that. Then Sudarshana Vadi or Shaddarana, that will help to reduce the joint pain and her jara itself. No problem. That will we can manage.
Okay, ma'am. Thank you
Okay,
so much, ma'am.
okay, okay.
Next question is like, doctor, even though after giving Shatavari Kalpa, some ladies don't get much of milk production. So sometimes because of stress and irregular sleep, which Kalpa can we use?
Yeah, here we have to manage that patient, that lady or Sutika, to reduce the stress itself, surely. And if there is any Agnimandya or if there is any Srodho Roda, then if there is any Nisha Jagarana, itself, that will causes the reduce in the breast milk. During that time, if we are adding some Vidaryadi Kashaya or Shatavari Ksheerapaga, that will not help. In such cases, we have to do the proper counseling on that lady. With due family support is needed there, and some Ksheerabala oil or otherwise Ashwagandha Churna, Ashwagandha in the form of Ksheerapaga, that may helpful in such cases. Okay, if it is stress is more supervision, then you have to evaluate if there is any Vata, with Agnimandya or Anuloma problem. If there is Agnimandya, then you may just give Ashtachurna in the form of in hot water or in Takra. That will also helpful to increase the breast milk because the proper absorption is needed, proper Shodhana is needed, we needed to address the psychological factor also. Okay.
Next question is from Vaidya Vishwanath Kumar. How to treat typhoid in Sutika?
Actually, I had not much experience in treating this typhoid in Sutika. Means if it is Sutika or Gapini, do you have any?
Sutika.
Sutika. I
Sutika.
think here also some conditions we can add by thinking logically we can add some cardiac tracks like Bala Kudituva, Bala Dusparsha Gadi Kashaya, etc. may helpful. But I don't have much experience in treating this typhoid during Sutika.
Next question, we have another question from Dr. Sabina. Do our medicines taken by mother cause colic and pain in babies? Some concerned patients says babies started pain and lose stools when they started our medicines.
Yeah, okay. Maybe there is a less chance to get through the breast milk itself. We just imagine that whatever the internal medicines or internal food they are taking by the lactating mother, some influence will also getting to the baby also. So if the by taking any aristas or like that, if there is any colic is happening to baby, the dose of the medicine should be controlled, and if it is needed, we have to change the medicine itself. Sometimes maybe Abhayarishta, if we are taking Abhayarishta or Gandharva Eranda, the influence may happen to the baby also. Okay, so that the dose of the medicine or otherwise if needed, the medicine we can change according to that, because the influence will surely get to the baby also, no doubt. That's why we are telling that for the means some bala rogas, the medicine have to be taken from mother itself. So the good aspects and the bad aspects may happening there. If it is getting any colic or other problem to baby, we have to strict the dosage of the medicine, or otherwise we have to change the medicine. It will be better.
Next question we have from Dr. Swati. In case of stillbirth or death of newborn, what can we do to reduce the milk production? I guess that's the question.
Yeah, sure, sure. In such conditions are happening in so many cases. So here, in my practice, I'm usually given Amritottara Kashaya, Punarnavadi with Kaishora Gugulu, and Jadamayadi Leba in Dhanyamla is also found to be helpful to reduce the stiffness and then mild hot fermentation to the breast is also found to be beneficial.
How to treat puerperal sepsis?
Okay, puerperal sepsis, if it is getting more than antibiotics may be needed, but as a parallel, we can give some Nirgundi, Kashaya as for the, then whatever the region, if it is on the episotal wound or whatever, where area the puerperal sepsis is occurring, we have to consider that. Some internal medicines like Gugulu Panchapala Churna mixed with honey, then here this Balakudituvadi Kashaya or Shadaka Kashaya may be helpful to treat here. Then if in the local area, then Nirgundi Patra, Kshalana or Avagaha Sweda in sitz bath is also found to be beneficial.
Next question we have itching during pregnancy management. I guess is it a
Yeah, actually, itching during pregnancy is very common finding I found from 7th month of the pregnancy itself, especially on the abdomen and different areas. There may be insomnia and like that. I think in my practice, I found it's helpful by using Haridra Ganda and Vilwadi Guliga for a short duration and Gobi Chandanadi Guliga are to be found helpful to manage the itching in pregnancy.
Ayurvedic medicines to avoid that we should avoid during pregnancy in OP practice?
Yeah, okay. In OP practice, it's better to avoid some medicines which are having more rasa preparations like Vettamaran Gulika, then Chukkum Tipalyadi Gulika, Vettamaran, Shidajuradi, etc. Like medicines which is having the mercury content should be avoided. It's better to avoid. Then some other Tikshna Kashayas like Deshmula Gadatraya, and such medicines are also not better to take internally. Then Vasha preparation is not good because this Vasha is found to be as a proven as abortifacient, so that Vasha should needed to contraindicated during the pregnancy. Okay, so more Tikshna, whatever we feel that if it is Tikshna medicine, it should be better to avoid.
Next is Samanga is Manjishta. Whether Samanga is Manjishta?
No, Samanga is Mukuti. Is it clear? I hope it is so. Manjishta is having another name. Samanga. Let me check and I will tell. I hope Samanga is Manjish. Samanga is Mukuti. Is it okay?
If
Okay.
there is any doubt, we can just unmute and ask about this.
Hello. Ma'am, whether Asavaristas can be given in pregnancy, ma'am? All Asavaristas?
Actually, I forget that to tell. Asavarishta we are not using commonly in pregnancies. But if it is on the second trimester, if she's having any penisa and like that, in small doses of Amritarishta for 2-3 days is not a problem. Okay, but
Okay.
for a long duration, we are not using asavarishtas to the pregnant ladies. If she is having very means fatigueness and low HB status, then draksharishta mixed with some boiled water in diluted form of arishta for small duration and for a less days for within 1 week or 2 weeks is not much problem. But it's better to avoid asavarishta during pregnancy.
Okay. Ma'am, after stopping lactation, ma'am, many patients will come for pain in the breast. Whether there is some procedure to stop the lactation in the mother, and what is the management of pain in after stopping lactation?
Yeah. Just I tell previously here same day itself. Amritottara, Punarnavadi Kashaya, then Kaishora Gugulu, etc. will be helpful. Then Jadamayadi Leba. Mixed with Dhanyamla as a leba is found to be very beneficial during such conditions. If there is any stiffness, pain on the breast, and like that, it will be better to manage.
Some persons practice here that they will keep some flowers in the.
Yeah. I heard that some
Whether it's helpful or what, ma'am? I don't know. That's why
I think there may be some psychological aspects by using this jasmine, like that of jasmine.
Yeah, ma'am.
It's okay. jasmine and techi. Some flowers are there, some smell, it's having good smell, and whitish flowers may helpful here
Yeah,
like
ma'am.
that. But I think there may be some prabhava, but usually I am practicing this type of medicine, which also found to be very helpful in managing that any edema or like that. If there's any tendency to get some jora, so then Vitamaran Gulika or Amrdarishta, Punarnavasa, etc. There are so many different choice of medicines we have.
Okay, okay, ma'am. That's a wonderful session, ma'am. Thank you so much.
Thank you, doctor.
Doctor, would like to add something like a samanga. It is given a touch me not plant. My Mimosa pudica, that is lajjalu. That's what it is.
Lajjalu, it's a Lajjalu, I think, Samanga. There may be one Mukutis have synonym of Samanga. This we can
Here it
confirm.
is given Mimosa pudica.
Yeah, it's
That is touch me not plant.
yeah, okay.
We had one more doubt, like in Ayurveda, before giving Brahman Chikitsa, should we give Agni Dibana Chikitsa?
No, sure. Because if she is not having proper Agnidipti, we have to, if any Kshirapaka or any Gruda, the same Jara Chikitsa, even we have to employ here the Garpini also. Because if you are giving any type of Kshirapaka, any type of Gruda, there should be proper Agnidipti. If it is not there, less quantity of simply Ashtajuna is not much problem, or Shadangabana we can give to Garpini. After get or Guruji is also some sort of Amapajana. Then after getting Acne Divya or even simply Takra itself by adding curry leaf and Haridra, it will or some ginger, etc. That will also to get proper Acne Divya. So after getting proper Acne Divya, we can give this Chirapaka or Gruda to Garpini. And in my practice, I'm using takra mixed with ashtajurna mixed with takra. It's very small dose is needed, as in the commonly we are practicing in this 10 gram, 20 gram is not needed. Here, very small doses of this ashtajurna is given to Garbhini.
Next question is how to treat the breast lump or cyst during lactation.
Yeah, during lactation, the lump is also we are managing like this same procedure. This Jadamadi labor churna for the external application. Gugula Panchapala churna we can give internally. If it is needed, then some Varanadi Kashaya is also helpful for the form of Andhra we can consider. And the Traindyadi Kashaya or Varanadi Kashaya, etc. may also helpful here to manage.
Next is chronic breast abscess in Sutika.
Yeah, so here also in the same treatment principle, because here Marmavatta or Kartavatta Leba in Kerala we are practicing very commonly. I think within a short duration, short days itself, that abscess will reduce by taking this external Leba, and the internal medicine is also helpful here.
Next question is how can we treat cramp at both legs during pregnancy?
Yeah, both legs during the pregnancy cramps may be due to the sufficient, maybe due to the insufficient calcium absorption. Here also for improving that absorption, we can give this Bala Kshirapaka internally if it is needed. Nayobaya Kshirapaka that I mentioned, Bala should be in more quantity, Nagara and the Jeera should be very less quantity. We can add and prepare the Kshira Kashaya from home itself by mixing Danandara Guliga. It will be very good to take internally. And some external application like Sahajaradi Daila may also found to be beneficial, or Danandara Daila may be good.
Next question is what are the kalpa which we can use in Garbhini Shushka Kasa?
Yeah, Shushka Kasa. I think here in the Shushka Kasa is the very useful drug I found is the Vidaryadi Krudha. Here, after taking the Vidaryadi Krudha in a small doses, it found to reduce the Shushka Kasa here. Then some lehya preparation is also not alone this Gruda, but lehya preparations like Vilwadi lehya, then Agastya Rasayana, even Haridra Ganda, etc. may be also helpful here.
If anyone is having more doubts, they can just unmute and ask also. It would be really appreciable if anyone can give a review of our class. Yeah, please, feedback.
Hello, ma'am. Hello.
Yes.
It was a wonderful session, and so many doubts are clear, and so many classical preparations from Kerala and tradition we came to know across this seminar. It was very wonderful, and knowledgeable to us. We will practice in our future, and we will look forward for another sessions also from you, ma'am. Thank you very much.
Thank you, doctor.
Thank you. Is there anyone who just want to share something?
Hello, ma'am. Hello,
Okay.
ma'am. I have that question regarding Shushka Kasa, ma'am.
Yeah.
Sometimes it's not alone Shushka Kasa. It will be along with the Pittanubandha, ma'am. So,
Yeah.
and you have told about Vidaryadi Ghruta.
Yeah.
So, if starting condition, can we use Ghruta or
So, and starting condition is not needed to take Grida. Here, this Vilvadilehya mixed with Shankabhasma or Agastya Rasayana itself give good results. If there is Agnimandya, Shadangabana is also good here. Then after that, after getting this acute condition, then we can take this Vidaryadi Grida. Vidaryadi Grida, if we are taking in a form of some mixed with hot water or like that. Okay.
okay, ma'am. And how to treat IBS like condition in this Garbhini, ma'am? Hello.
I guess doctor's connectivity is a little bit
Yes.
stuck. She's stuck, I guess so. Excuse me, doctor. Am I audible?
Yes, ma'am. Yes.
Dr. Jasal, we have actually lost the connection.
Okay, let me check.
Yes, okay.
Yes, you
Hello,
can
ma'am.
ask your doubt, doctors.
Yes. Hello, ma'am.
Yeah.
Uh,
Okay.
I have in IBS condition, ma'am, in Garbhini, ma'am.
Mm.
How to treat IBS means which kalpa we can use.
Yeah, here in IBS condition, I found it's better to take this musta preparation will be beneficial here. Here musta can be as in the form of boiled water. Then Dadimashtaga Churna in Takra will be more beneficial in IBS condition of the Garbhini.
Okay, ma'am. Thank you so
Yeah.
much. Thanks
Hello,
a
ma'am.
lot.
Yes,
Hello, ma'am.
okay.
Hello,
Okay.
ma'am.
Okay.
After LSCA, some mothers don't get a single drop of milk secretion. So, what can we do for that after
For
cesarean
getting,
section?
yeah, for milk secretion, is it? Lactation?
Yeah, and I have got two patients. They are not having a single drop of milk. From second day, first day also, they are not having anything.
Yeah, sure, doctor.
Totally
In most,
loss.
yeah, yeah. Here in some condition, after getting LSCS, there may be so many problems regarding this breast milk secretion. Here I found the better result with Vidaryadik Shirabhaga, because in our science itself, Acharyas are mentioned after 3 days of this Utika, they can give the Vidaryadik Shirabhaga. So Vidaryadik Sukshma Churna we can add in the form of milk decoction, and we can given the means Sutika. Just after the
Ma'am, should we give something for Strotoshodhan? I have tried all Jira Karishta, the Anvantaram, Arishtam, everything. I
here,
have given Svedan, but still no secretion. Should we give any Agni Deepan
yeah.
again?
Then
Okay,
if
ma'am.
needed, we
Like
can give this.
Astachurna,
Yes, Astajurna. Astajurna
bleeding?
is better to give internally, mixed with
Okay,
Takra.
ma'am.
Yeah.
Okay.
Then
In
after
after
this